morning. How are you doing today, Nikki?
It's been a long week again.
Okay.
I'm tired. I don't know.
Okay. How have things been since our last session?
I'm still feeling really overwhelmed. I don't want to get out of bed in the morning still. The housework just keeps piling up. My husband tells me I need to put more effort in. The kids are... I don't even know. I just can't stop thinking about my mom.
Okay. Sounds like you've been having a lot of things going on both in your head and also with your various responsibilities.
Yeah, that's probably a fair thing to say.
Mm-hmm. Have you noticed any changes at all since we last talked? I know that we covered some important topics like major depressive disorder and...
It just feels so overwhelming, so now I've got like depression, which is hard, and I don't know.
Okay, so it sounds like you're feeling a little bit overwhelmed both by all of the things that you have to do and also by the uncertainty related to how you're going to figure all of this out. Is that an accurate statement?
Yeah, that's pretty good with summary of things.
Okay. Got it. Well, as we talked about a little bit last time, I think that counseling should be something that should help you to get feel a little bit less overwhelmed and figure out how to tackle some of the various things that you have on your to-do list.
That'd be nice.
And last session we went over some of the results of your intake interview and your assessments. And we talked about how your symptoms of feeling overwhelmed and hopeless and not enjoying much of anything and sleeping a lot and overeating are consistent with a diagnosis of major depressive disorder.
Yeah.
Yeah. Do you have any further questions on that? I know this is kind of
I don't know which questions to ask. I don't know. I'm just so overwhelmed. I'm tired of crying. I'm tired of not being able to stop thinking about my mom. I'm tired of feeling like I'm failing at everything that I'm doing. The housework just keeps piling up, and my husband says he wants me to focus more on him. The kids and their stuff, and it's just, I don't even know.
Mm-hmm. Yeah, it sounds like you have a lot of things on your plate right now.
Yeah.
And the feeling of being overwhelmed makes sense with all of the symptoms that you've been talking about and all the various things that you've been having to juggle.
Thanks.
Yeah. And one of the things that we're hoping to address here in counseling is sometimes when we face a problem, it can seem kind of insurmountable, kind of overwhelming.
Totally feels insurmountable.
Yeah. And part of the goal for counseling here is if we can take this big problem, we can kind of break it down into smaller steps. It should be easier for us to work together and eventually reach your overarching goal.
Okay.
So what I'd like to be able to do here is now that we've completed the and before let's step back a little bit here.
Okay.
Last session I explained a little bit of the framework of cognitive behavioral therapy. Do you remember that discussion?
You talked about how something about how my thoughts can change with practice or something. Is that what it was?
Yeah, that's a pretty good summary.
Okay.
So the idea of cognitive behavioral therapy, as I explained, is that your thoughts and your emotions and your behaviors are all intertwined. And so how you think about something will influence how you feel, and what happens when you do something influences whether you do something again. So if you do something, you get something really positive out of it, you're more likely to do that behavior again, versus if you do something and you don't get a good response, then you're less likely to do things.
Okay.
And so the good news from a cognitive behavioral perspective is that both thoughts and behaviors are things that we can change. And yeah.
Do you really think this is gonna help?
Well, I can tell you that in my experience, I've had a lot of clients have success using this cognitive behavioral framework.
Okay.
And it's going to take some work on both of our parts, but as you start to change some of your patterns of thinking about things and some of your patterns of doing things, it'll become easier and easier to stick with the new pattern versus going back to the old one.
Like a different rut?
Kind of, yeah.
Okay.
Yeah, so when you're first trying to, if you're first trying to forge a new path, it's going to be kind of difficult. But as you slowly keep going on the same path over and over again, it gets worn down more, and then it's easier to do that. And so that's actually a really good description of what our process is going to look like.
And making new ruts.
Yes.
Okay.
Yeah, it's a good way of putting it. So as I mentioned in our last session, once we've completed the intake process, I like to develop a treatment plan. And kind of going back to your idea of the big overwhelmedness of the problem, a treatment plan is basically a roadmap for treatment. And so it breaks down our big overarching goal into smaller stepwise pieces. So that way it's a little bit less overwhelming to get started. And so that way we both understand what our end goal is, and so that way we know how to pursue it.
Okay.
And it includes a couple of different components. It's going to include your goals for treatment, the interventions and treatments that we are going to use in treatment in order to address your goals, some other resources that we can utilize besides counseling to help you, and also the discharge criteria, or how you and I will both know when we've achieved your goals for therapy.
Do you think we will?
I think this is something that we have a high likelihood of success for. So depression is something that I see pretty regularly in the counseling office, and cognitive behavioral therapy is something that has been shown to be pretty effective in treating major depressive disorder.
Okay.
So I think this is something that we can both work on together, and I think that we have a pretty high likelihood of finding some success here.
Okay. I hope so.
Yeah. Sounds like you're both feeling overwhelmed by all of the things that are going on, a little bit almost uncertain to hope for this too. Would that be a...
Yeah, it just doesn't feel like things are gonna get better. It feels like it's probably all my fault. And like I said, I don't want to get out of bed. And all I want to do is eat. And my marriage is struggling, and the housework, I'm not very good at dusting. I was never very good at dusting. But the laundry is piling up, and the dishes are piling up, and the kids' schoolwork is so much. And then my mom, ugh.
Yeah, and it sounds like you've got a bunch of specific concerns that are currently weighing on. You've got the relationship issues, you've got the problem with your mom, you have some of the various housework that you have to handle. And part of my goal here for this process is for us to come up with specific goals and things that you want to address, because therapy tends to be most effective when we can make it individualized or unique to your specific situation. And what I'd like to do here is kind of have a collaborative back and forth here, because the most important thing is that we determine what your goals are for therapy, and I want you to understand the general process, because I want you to feel comfortable that this is something that's actually going to address your needs. And one of the important things with therapy is that it's flexible, and so we might start off.
So like if I change my mind after a little bit, we can address something different?
Yes, that's because part of I think with my perspective, sometimes when I have a problem, it's kind of overwhelming.
Yeah.
And while it's helpful to break things down, it can be a little bit daunting to think, well, what if this isn't the right thing?
Mm-hmm.
And what if I'm missing something?
Yeah.
And so our goal here is to develop a specific plan for therapy, but it's not set in
kind of
stone.
just start with.
Yeah, it gives us, so that way we at least have.
I don't think I can handle all of it. I think there's so much, and if we try to take all of it, like
Yeah, and that's kind of part of the reason that we have the treatment plan. It gives us a next step to take, so that way we aren't worrying about what we're going to do next, but it's also flexible. And so I want, my goal for this is to be a partner with you. And so if we're doing things and you're really not feeling like you're getting the success that you wanted, I want you to talk with me, and we can change things, that way we best address what you need.
Sure.
Thank you for voicing that. You've done a really big step by coming in here. It's a.
Doesn't feel like it, but I'm glad you think I'm doing something good.
Yeah. Well, one of the things that we'll learn is sometimes our feelings don't really, just because we're feeling something doesn't mean that feeling is necessarily true.
Okay.
And so part of the goal for cognitive behavioral therapy is we're going to learn how to challenge some of those thoughts and feelings and see whether they are based in more objective things out in the environment, or if it's just a feeling. Does that make sense?
Kind of, like I said, I'm so overwhelmed, and I just, the idea of having to deal with all this stuff is, but okay, I can take on a few things.
Yeah.
I mean, that's why I'm here. Right?
Yeah. Well, since you mentioned some of the things that you've been overwhelmed with, why don't we start with kind of reviewing the problem list that we developed from the last session.
Okay.
So I know that you mentioned one of the big things for you was you feeling overwhelmed with a lot of different areas of your life, with your marriage, with your kids, with your various housework and duties that you have to complete.
And the biggest thing is just my mom, because no matter what I do, I'm never good enough, no matter what I do, and now she just cut me out of her life. And I shouldn't be thinking about it all the time, but that's what I keep thinking about. And like, you don't think your mom's gonna reject you, but then she does. And then, I've got a husband, and that's good. And I've got kids, and that's good. But like, I just can't stop feeling like I failed at it all. And I'm just a housewife, so I don't do a whole lot, but I don't even keep up with the housework now. I'm sorry, you were talking.
No, it's important for you to be able to talk and process things out as well. And what I'm noticing as a theme is you've mentioned a bunch of different areas that you're struggling with. You're struggling with, your husband and your kids and your relationship with your mom. And a theme that I'm noticing is that you're just kind of feeling overwhelmed and like you're a failure in a lot of different areas.
Yeah.
I think that's probably, would you say it's probably one of your main concerns for treatment?
Probably.
Yeah, and I'm sorry I didn't mention this earlier, but I'm just going to be typing things out on my computer here, so we've got something to look back on for the treatment plan. So feeling overwhelmed is probably one of our problems here. I know that you also said in the last session that you've been having issues not having interest in activities or spending time with other people like you have in the past.
I figured they're just going to reject me too, because I'm not offering anything good, so yeah.
Okay. And so for you, the reduced interest in things is due to a fear that it's either not going to turn out well, or that
I'm just going to screw it up, because, I just can't do it right, and I fail at so many different things. My husband still says he loves me, I don't even know why.
Okay. So we've got, on this list, we've got feeling overwhelmed, not having interest in activities or spending time with other people. I know you mentioned some sleep concerns last time, and some.
I just want to just lay in bed, and I just want to sleep and eat. Like that's all I want to do is sleep and eat and cry.
Mm-hmm. Yeah, that's a lot of things to handle at one time.
Yeah.
So of our problems that we've got listed here, we have the feeling overwhelmed, we have the relationship concerns, we have overeating and oversleeping, and then having reduced interest in activities and spending time with other people.
Yeah.
Would you say that's a pretty good?
It's a good place to start, yeah.
Yeah, okay. Now, of those problems, which one do you think is probably the most important one that you want to target first in treatment?
Maybe not feeling as overwhelmed.
Okay. I think that's probably a good starting point too.
Okay.
Because if you're feeling overwhelmed, it's gonna be harder to change some of those other things. If you're, I know in my experience, when I've been overwhelmed, it's hard to do even the most basic things like completing, I like laundry and things like that. And so if we can target the feelings of overwhelmedness, that should probably give us some good chance of addressing some of the other problems. Do you have any idea of like which problem you'd list as like a secondary concern?
I should probably be spending less time in bed because nothing else gets done when I'm in bed.
Mm-hmm.
My husband says he wants me out of bed more often.
Mm-hmm. Okay, so reducing time spent in bed would be another like important. So we're gonna put that one up towards the top.
Okay.
Where do you think you'd like to put not having interest in activities or spending time with other people?
Are we at 3 or 4 things?
We've done 2 thus far. So we've got feeling overwhelmed as the first one, and we've got sleep concerns pretty high up there as well.
It's probably like relationship things next, I guess.
Okay. Got it.
Because like my husband's really good, and I want to work on improving things, and I don't even know where to start with my mom. So.
Mm-hmm. Yeah. Those are big things to undertake. And so, and then we'll kind of end. We've got the overeating and the little interest in activities kind of lower down on the list.
Sure. That sounds
You
good.
say?
Yeah.
Okay, got it. That makes sense. So now that we've got our basic problem list, that things that we want to focus on in treatment, let's try to focus on what are your goals for treatment? What do you want to get out
I just want to feel better.
Okay.
I want to feel like I suck at everything.
Mm-hmm. So to make sure I'm understanding you correctly, your goal would be to kind of reduce the symptoms of depression and to have and to feel more confident and less like you're a failure. Is that?
That'd be good. Yeah.
Okay.
And I got caught up with housework, and I don't know if I want to pursue much with my mom, but at some point probably should talk about that too.
Okay. Yeah, that is a very important thing and something that I think would be very good to address. I think it'd probably work best if we tackled some of the other problems first to give you a little bit more confidence. There are a couple of different theories in how we choose which problems we target first, and sometimes I found it's helpful to pick an easier problem to start with, so that when we have some success that can
less deep rut to get into.
Yes, going. I like the analogy. It's a little bit easier in that way. We've got something we can look back on and say, well, I succeeded in that area, and so I can keep going.
Okay.
So goals. One of them is to improve the ability to accomplish your various tasks at home, and then another one is kind of improving, like reducing your symptoms of depression.
Yeah.
So feeling better. So let's start with kind of those 2 first, if that's okay with you.
Sure.
One of the things with having a goal is it's helpful if we can kind of make it specific, because if I have a goal like feeling better, it's kind of hard for me to determine whether or not I've met that goal or not. And so in counseling we have a thing called SMART goals, which stands for specific, measurable, attainable, realistic, and time limited. And so kind of taking our overarching goal and making it more specific, so that way we can know when we've reached that goal, and if we need to change anything to better reach that goal. So for the reducing the symptoms of depression, what would be like something specific?
I don't know, do you have any suggestions?
Yeah, well, I know that you've mentioned that you felt overwhelmed a lot.
Yeah.
And you've also mentioned that you tend to you find yourself thinking about the same problem over and over and over and over again. So I'd say if we can, something specific might be to reduce the amount of time you spend thinking about things. From a cognitive behavioral model of depression, we call that rumination. And so rumination is continuing to focus on a problem and dedicating a lot of mental energy to it. And sometimes it feels helpful in the moment because you're trying to solve something. And so, but the problem is when we're focused so strongly on the problem, we can lose track of other positive things, which can help you to feel a little bit more confident.
Sure.
So, so reducing the level of rumination, and we want this to be measurable here as well. So, one of the things that I'd like to work on is we have a thing in counseling called a thought log, and so it's basically a piece of paper, and when you start noticing that you're having some rumination or thoughts that are really repetitive, you mark it down and you write down what the thoughts are and you write down how you're feeling about it.
Should I have like a notebook or something?
Yeah, and once as we get towards the end of the session, I'll give you some resources. And so cognitive behavioral therapy is big on having homework between sessions. And so the goal is that we're not going to likely have a lot of change if we're only doing things for 1 hour during the week. And so I like to have clients do some work during the week in order to keep using the skills and learn them and get more comfortable, so that way we can really get you used to getting out of the current rut that you're in and developing a new path. And yes, path is probably a little bit more of an optimistic term, but yes, a new path for your thinking and your behavior. So I think we'll get you set up with doing more of that thought log. But I'd say if we can probably reduce the amount of time you're spending ruminating by maybe would you say 50%? Does that sound like a good?
So I keep track of how many times I'm thinking about it now, and then over time we can kind of look back.
That's kind of the goal. So we set a baseline, and then we want to
So I don't have to cut back 50% before next week.
No, this is a longer term goal for us to work on together.
I think that sounds like a good goal.
Okay. Now, do you feel like that's something that is something you can achieve? Is it attainable for you?
The thought log for sure is. 50%, I don't know.
All right.
Maybe.
And once again, this plan is flexible, and so we can always change things as we go along. Is that a number you're comfortable starting with?
Sure.
You want to? Okay, cool. And then I think that is something that should be a realistic goal for counseling. It's a pretty consistent goal for cognitive behavioral therapy. And then we want to have a time frame for this goal. So, do you have any idea of when you'd want to try to accomplish that goal by?
To get to 50%.
Mm-hmm.
Do you think I could do it in a month?
I think by the time we've done it in a month, we should see some noticeable progress.
Okay.
So we may not have the complete goal reached, but we should definitely see that the amount of time you're spending ruminating has decreased.
Okay. So
we'll put down a 1 month timeline to kind of review our progress on that goal and see how it's been going. Do you have, so just to kind of summarize our goal here, so the goal is to reduce the level, symptoms of depression, specifically to reduce the level of rumination, and we're trying to reduce it by about 50%, which we're gonna kind of evidence by your thought log. And we feel like that's pretty attainable and realistic, and we're gonna review that in about a month.
So what do I think about instead?
That is a great question. And one of the other things, so now we've got our goal, we can kind of focus on some interventions that we can do to help that. So as I mentioned, doing the thought log, so keeping track of when you're having negative thoughts and focusing on what the thought is, what the emotions are related to it, and then one of the things that you and I will work on in the process of therapy is learning to challenge our thoughts.
Okay.
And so when you have a thought come in, instead of just accepting it, starting to question, go, what is that thought? Like what, is that something that's true? Can I think of any examples that show that's not true?
Okay.
And then once you challenge a thought, you can substitute it with something else.
Okay.
So for example, I might have a thought that like, man, I feel like I am a failure because I haven't gotten my laundry done yet today.
Yeah.
And so I can take that thought and go, okay, wow, I feel like a failure about that. So a failure is kind of a big word. Is my ability to accomplish laundry the determining factor of whether I'm a failure?
Okay.
And I can think about that and go, no, that's not something that determines whether or not I'm a failure. And then I can substitute and go, yep. So I haven't gotten my laundry done, and that's an important issue for me to get done, but I am doing a lot of things well, and so I am succeeding in this area or that area, and so you can kind of substitute it with a more positive thought process. Does that make sense?
Yeah.
Okay. Then so we're gonna focus on doing the thought log, and then I think probably for you focusing on listing some positives as part of like a self-compassion exercise.
Okay.
My
husband's always telling me that I gotta focus on what's going well.
Yeah, and so I think that would be a good thing for us to work on as well, is keeping track of like things that are going well in your day or things that are good about yourself.
Okay.
What do you think would be a manageable way of doing that? Do you want to do that like every
I've got the notepad, like, do I like write things down in there?
Yeah, I think we can definitely get you a page.
Okay.
So do you want to shoot for like maybe writing down like 3 or 5 positive things?
3. I think it'd be 5.
Yeah, that's great. So we're gonna focus on listing 3 positive things about yourself or about your day per day.
Okay.
We can do that in the same notebook that I'm gonna send you home with.
Okay.
And then kind of going back to our other goal of improving your ability to accomplish different tasks. What do you think would be something specific that we can do to show that we've attained that?
Which one is this?
Sorry, that wasn't very clear. So the other big goal you said was to improve your ability to accomplish tasks and to have interest in various activities. So
So, like a to-do list of fun things or something?
kind of, yeah.
Okay.
So one of the things that we recognize with cognitive behavioral therapy is that we can change both thoughts and behaviors, but sometimes it's easier to change behaviors than it is to change thoughts. And so I know that you have a to-do list of a bunch of things that you need to get done. We've got to deal with the laundry, we have to make sure you're spending time with your husband and things like that. But it's also really important to schedule some positive things, because sometimes, I know that you've expressed that you feel like you aren't getting a lot of joy out of doing your various activities. And sometimes when someone is struggling with depression, people can have a difficulty anticipating getting something positive out of an activity, but when they actually do the activity, they still actually have positive emotions that come from it. And so part of this is going to be learning to push through and do an activity even if you don't feel like it.
Like I'm here.
Yes, yeah, this is a good example. And then kind of keeping a record of it so you can look back and see, okay, I didn't think I was going to enjoy this. I did actually enjoy this.
Okay.
And this also gives you some more positive things to focus on in your day, which should help with the goal of listing some positive aspects. So one of these things that we can do is something called behavioral activation therapy. And kind of as you put it, it's a fun to-do list. It's a scheduling positive activities.
Okay.
So I know that you said these symptoms have been going on for about like a year and a half, 2 years range. What were some things that you enjoyed doing before this all
I
kind
used
of
to
happened?
like to do artsy things. Like, I used to like to color,
Mhm.
and I used to quilt. I haven't had my sewing machine out in such a long
Mhm.
time.
Okay, so it sounds like you've got some things that you used to enjoy doing. Are those things that you're doing right now?
No.
Okay, got it. So of those things, what's something, and it's kind of best to start with something small, so that would
Coloring is easier than quilting.
I would have to agree with that.
Okay.
I definitely can enjoy doing some coloring myself.
Yeah.
So would like to increase your time spent
So
doing
I make
coloring.
a to-do list that includes coloring.
Mhm.
I can work on that.
Yeah. So let's, so our specific thing is to spend some more time doing coloring. How much time do you want to spend on coloring for a measurable thing?
I don't know. I could probably takes 5 minutes just to put the stuff up. So, 20 minutes?
20 minutes? So spending 20 minutes on coloring. And how often do you want to do that in like a
I
given
don't know.
week?
Probably, I don't think I can do more than 3 times a week.
Okay, so we're starting off here with 3 times a week, spending about 20 minutes on coloring. I think that should be something that's pretty attainable. Would
Okay.
you agree with that?
Yeah, I can probably do that.
Yeah, and I think that's something that we can realistically accomplish during
Okay.
therapy. That's in terms of reviewing our goal. It's how long do you think it would take for you to start implementing that goal and seeing some changes?
Well, it's only 20 minutes of coloring or so. I can probably do that in the next week.
Yeah. Okay. So we'll kind of check back on that one in a week and see how
Sure.
that one is going. And then let's think of a couple other activities that we can add onto this list. You mentioned the coloring.
I don't think quilting I can do. How about going for a walk?
Going
it's
for a
getting
walk.
to be nicer outside. I hear walking is supposed to be good for you.
Yeah, no, walking can help with, actually has been shown to, exercise has been helpful in reducing some symptoms of depression in some people, so that sounds like a good goal.
Okay.
How long of a walk would you be wanting to take?
30 minutes maybe?
30 minutes? Okay.
I
So,
think that's about how long it takes to get around the blocks there.
okay,
Yeah.
alright, and how often do you want to go on a walk in a given week?
How about just twice a week?
Twice a week then? Yeah. Twice a week, alright, and I think that one should be pretty attainable and
Okay.
realistic. And we can check back on that one in a week as well, would you say?
Sounds good.
Okay. And I know that you mentioned that your husband has been wanting to spend some more time with you
Yeah.
and your kids. Do you want to
Yeah.
schedule something with?
So like movie time or something? Would
Yeah,
that-
I think that's a
Okay.
good idea. Did you and your family enjoy watching movies together in the
Yeah.
past? Okay. So watching a movie with family.
It doesn't take too much effort.
Yeah, it's a good starting point. So how often do we want to do that one? That's a little bit of a longer
I
one.
actually like once a week.
Yeah, I think that's a
Okay.
reasonable thing, and your family also probably has other things that they need to do during the week besides just watching a movie.
Yeah.
So, which day do we want to plan to watch the movie on?
We don't have anything going on Thursday nights.
Okay. So on Thursday nights it's going to be movie night
Yeah.
with the family. Okay. I think we've got a pretty good list of a couple of activities
Yeah, I don't
to
know if I
start
can
with.
handle much more than those.
No, it's important for us. Like I said, this is going to be stepwise. So we're going to set small steps.
Okay.
And as we accomplish those, we can add more things on as we
Okay.
go. Now, it's important for us to have these listed. One of the really important things is going to be teaching yourself that these activities are enjoyable. Because right now it sounds like you're struggling to find interest in things and see the value in doing them. And one of the ways that we can help with that is kind of similar to keeping track of the thoughts, is keeping track of the activities. And so you have your
I
schedule.
write that in the same notebook.
Yep, same notebook. And so when you're about to go down for coloring, you can write down that you're doing the coloring. You can
Check.
Yes, you can. It's also good to have something you can check off the list.
Okay.
And you write about what your feelings are about it beforehand.
Okay.
And then once you're done, you write about how you're feeling, and so that way you've got a nice record that you
Okay.
can go back. And I want you to particularly pay attention to if your expectation for how much enjoyment you're going to get out of it matches how much
Okay.
enjoyment you actually do get out of the activity.
So I'm not expecting a whole lot, but
Mhm.
then hopefully by writing it down I might feel better. Is that
Yeah.
the thing?
Yeah, and kind of teaching yourself that
Okay.
sometimes your expectations for how much you're going to enjoy an activity are lower than how much you actually do
Okay.
enjoy the activity.
Okay.
Do you have any questions about
No,
that?
that's good.
Okay. So I think that's a good goal for that as well. Do you want to stick with those two goals? Do you want to
Yeah,
add?
I don't want to add anything else right
No,
now.
and that is completely fair. And like I said, this is meant to be your treatment plan, and so what works best for you is the goal. So we've got some of our interventions. We've got our goals. One of we talked a little bit about focusing on strengths. This is a really important part of counseling because sometimes when we focus so much on the problems, it can be kind of overwhelming, and it can feel like, wow, how am I going to overcome this big problem? And so it's important to recognize that there are some strengths that you have which can help you accomplish these goals, and which we can rely on in the process of counseling.
Like what?
Well, that's kind of something I'd like to talk with you about. So I know you've mentioned a couple times that your husband has been pretty supportive.
Yeah.
Would you say that that's
Really good guy.
yeah. So it sounds like one of your strengths is that you have a close relationship with your
He's
husband.
still with me, which is really nice.
Yeah. And it sounds like that's something that's been pretty important to you.
Yeah.
Kind of like an anchor in the midst of all of the other
Yeah.
emotions and uncertainties that are going on. Mm-hmm. Okay, so that's one strength that we can list down. Do you have any other things that you find yourself like kind of
Doesn't have to be about me, right?
It can be about you. It can be about other relationships that you have or other.
I've got the other friends I used to talk to from church. Sometimes they were helpful.
Mm-hmm.
You know, I don't know.
Okay, so it sounds like you've got some supportive relationships with both your husband and your friends, which you could rely on some more.
Yeah.
Okay, those are both good strengths. Let's try to think of one additional strength. We've got some relational ones. I know, like when we did some of the assessments, you scored pretty high in the intelligence area.
Yeah. I always did good in school.
Mm-hmm. Yeah, I think that can be a good strength as well. I know, you seem pretty comfortable with, keeping track of things and using a notebook.
I used to be better at it, but
yeah. But it's also something that we can kind of leverage in the treatment process.
Okay.
So we've got some strengths there. And in addition to our treatment plan for counseling, it's also sometimes helpful to use other services. So counseling can be really helpful for helping with the emotions and the thoughts and the behaviors, but sometimes it's helpful to have other resources that we can use to kind of target the problem from multiple angles.
Like what?
Well, I know that you've been saying that you've been having these symptoms for a couple of years, like 1.5, 2 years. And while cognitive behavioral therapy is known to be pretty effective for helping with depression, sometimes it can be helpful if we can consider adding a medication on, like a selective serotonin reuptake inhibitor. What are you thinking about that?
It just feels like I fail more if I eat meds.
Mm-hmm. Okay. And so the idea of needing to rely on medication indicates that you are a failure because you couldn't, because you're relying on something else. Yeah. And that's a difficult, I can understand your thought process behind it, and it's kind of overwhelming when we need to rely on other things to help solve
If
problems.
you think it'll be helpful, I can go and talk to them.
Yeah. Well, and this is something that we can talk more about. Part of the goal with medication is not for you to be on medication forever, but medication can kind of help reduce some of the negative symptoms. That way you have more energy and you have more focus, and that can help you better engage in the counseling process.
I'm willing to consider it.
Okay. So I after we're done with this, I can help give you some referrals to a couple psychiatrists, and you can talk to them, and you can share some of their concerns.
I gotta figure out insurance. Insurance is so frustrating. but, okay.
I completely understand you there. We actually we have a pretty good referral network, and so we're pretty effective at finding providers who accept your specific insurance.
Okay.
And so I think talking with the psychiatrist, mentioning your concerns, feel free to be honest with him about your concerns about medication. That's kind of part of this whole process.
Okay.
And I know that you also said that you've been having some difficulties with your husband. You said he's been pretty supportive, but sometimes you feel like you're having a little bit of difficulty connecting and talking.
He wants me to put more effort in, and he says I'm doing a good job, but I know I'm not. And it's just so hard.
Yeah, and it sounds like you are feeling both grateful to him for his continued, you mentioned it was one of your strengths, but you're also feeling, almost sounds like a little bit overwhelmed and guilty that he...
Like, I don't even know where to begin to fix things with him.
Yeah, and that can be a hard situation to be in. And one of the things that might help is that in our agency here, we do also offer some couples counseling.
Okay.
And so it might be helpful to consider, if your husband is interested in the process, doing some couple sessions together where you
I don't have to do that right now.
No, that's something. No, this is something that we can consider, and it might be helpful if we can kind of tackle some of these initial goals first, and then once we've had some success with that.
I don't think I can take on a whole lot more right now.
Yeah, no, that is completely fair. So we'll kind of table that discussion for later, and we can revisit it once we've had some more success with the treatment plan. And then one of the things that's important is we have our treatment plan here now, and it's also important to consider both what we're hoping for success and also some potential barriers, because if we don't think about how things might go wrong, then when they do go wrong, it can be a little bit overwhelming to figure out how we're going to fix them.
Well, so what happens if more things show up? Because if there's more, I don't know if I can handle all the rest of that.
And what do you mean by more things?
Well, like, my kids are getting ready to go off to college, and I don't know how I'm going to handle that. And then they're eventually going to get married, and then they're going to, have kids, and then I'm going to be alone, and I'll probably screw that up too. I don't know.
Sounds like you have a lot of fears about things that might go wrong in the future there. Yeah. And those fears are valid. I think what's probably going to work best for us right now is focusing a little bit more on the in the present for barriers, because while those issues are important, we're most likely going to have success if we can kind of focus on changing your current thoughts and behaviors, and then that'll give us some strengths and tools that you can then use when those bigger problems come up again in the future. So I know you said that you can lack energy sometimes. Do you feel like that might be a barrier to implementing?
Yeah, that's a barrier.
Okay, so lacking energy can be a barrier to doing the various activities. So what are some ways that we could anticipate that and work around it?
Well, maybe with the walking it might help a bit.
Yeah. So focusing on the walking as a way to gain energy.
My husband keeps telling me I need to get an alarm and get out of bed.
Okay. And then so you said potentially setting an alarm so that way you were spending less time in bed and spending more time doing things.
Yeah, that's probably all I can handle right now.
Okay, that makes sense. And I know that you've also said that you felt like you're kind of overwhelmed by all the things that you have to do. Do you have any worries about whether or not you're going to be able to remember to do them or have motivation?
There's so much housework to be doing. And then I do the dishes and they get dishes dirty again. And the laundry never stops. It never stops. It never stops. And the dust. I'm really bad at dusting. I used to have a routine, like a schedule thing. I don't know, but I screwed that all up. I'm not doing that either anymore. I don't know.
Yeah. So what I'm hearing is that you are feeling a little bit
hopeless.
hopeless a little bit about the amount of things that you have to get done and when you
I
finish.
used to do it all better, but I don't know.
Yeah. Okay. Well,
Maybe a psychiatrist will help with that too.
that could be something that could be helpful too. And I think, as you mentioned, when you had the to-do list, that it was helpful. And so I think focusing on, I'm wondering if focusing
Like
on.
I used to have like a day that I did each of the things. So
Okay.
like laundry was on a Tuesday and dishes you gotta do every day, you know.
Yeah.
And I used to have a thing where like Wednesdays were the kitchen, Thursdays were the bathrooms, you know, and I used to do a little something every day. And so you think I should start that back up again or something?
What do you think about that?
It worked before.
Okay. So returning to trying to use the schedule that you had for housework.
Sure.
Could be a way of feeling a little bit less overwhelmed. That also, you can probably integrate that a little bit with your schedule for the fun to-do
This
list.
notebook is gonna get used a lot, huh?
Yes, it is.
Okay.
Yeah. And I'm wondering too if you mentioned that your husband's been pretty supportive. I was wondering if maybe we could. Do you think he would be interested in helping to remind you to do some of the fun to-do list activities?
Yeah, he could do a good job with that.
Okay, so it might not be a bad idea to consider maybe sharing your plan with him.
Okay.
This is obviously, up to you,
Okay.
but it might, sometimes it's helpful to have kind of an accountability
He kind of
partner.
wants to know what's going on, so.
Yeah.
Yeah.
So it can be nice to have an accountability partner,
Okay.
who can both encourage you to keep pursuing something.
He'd probably like it if I clean the house better too.
Yeah, well, there's a
Patient with me with my dusting. I'm not very good at dusting.
and there can be a lot of benefits to engaging in this process.
Okay.
And that a clean house, while far from the most important thing from your value,
It does help.
It does help too. Yes. Yeah. And then we've talked about some barriers. Do you feel like there's any other large barriers that you're seeing right now?
That's I can't handle more.
That's completely fair. All right. And then kind of talking a little bit more on the long-term scale here. Eventually, my goal is that you and I will look back at this plan and realize that we've accomplished it and that you
That'd be nice.
don't need to keep seeing me.
Okay.
And so, based on your current level of symptoms, generally we try to schedule for about like 8 to 12 sessions.
I think it's gonna take me a lot longer than that.
Well, let's start with the 8 to 12.
Okay.
And like I said, this is flexible. So we're going to keep reviewing your progress periodically to see where we're at in accomplishing the treatment plan. And if we start getting closer to that, 8 to 12 mark, and you're really still struggling a lot, we can totally extend things.
Okay.
It's just good to have. Sometimes it can be helpful to have
I
an
think
end.
I can start feeling better in like 8 or 12 sessions. I suppose maybe.
And part of it is sometimes having something that's limited can help encourage you to
I gotta do my homework.
yes.
Ugh. Okay. I was good at school. Okay.
And it sounds like you've got some good motivation.
Yeah.
And I know at our first session we did the Beck depression inventory. I think that can be a good indicator of how you're feeling, because sometimes, if I ask you how you're feeling, it's hard for you to compare that day to day. And so I'd like to see a reduction in your score on the Beck depression inventory to below clinical levels. I think that would be a good discharge criteria.
Sure. Sounds good.
Does that sound reasonable to you?
Yeah.
Okay. And as we mentioned earlier, kind of reducing your self-report and logging of the rumination or overthinking. And kind of, I know you've mentioned that you've been distressed by your level of disinterest in activities and not getting things done. How do you think we could view that in terms of
do you have any ideas? I don't know.
So I'm wondering if maybe we can get you said that in the past you were able to do a lot of these things. So I'm wondering if one of our criteria for finishing therapy would be the ability to follow your schedule and do activities with your family and friends that you were able to do in the past.
Okay, that sounds good.
Yeah. Now, do you feel comfortable with that listing?
It's a lot, but we can start with it, I guess, and then we'll see.
Yeah, that makes sense. Well, Nikki, again, I thank you for meeting me here today.
Yeah.
I know that this is a big step, and it can be overwhelming.
Mm-hmm.
I appreciate your willingness to engage back and forth
Yeah.
with me in developing this plan, and I think that we should be able to see some success together.
Good.
Do you have any other questions for me?
Nope, can I stop being depressed now?
We
Oh, praise God. Okay, good.
can pause it then.
So, have a good day.